Thank you. Paul, shall we wait for Rachel, or shall we kick off without, what do you want to do?
I think she's joined. She's at the back of the picture.
Oh, hello Rachel, good morning, welcome.
Good morning, thank you very much.
Sorry, I didn't see you join. Okay, Tom, we'll make a start then when you're ready. Thank you.
Yeah, ready.
Okay, good morning everybody and welcome to this Outbreak Engagement Board on Tuesday the 11th of August. Start off, please. We have none. I just wanted to welcome you all, and I wanted to welcome Paul Charnock from Health Watch if you're on this call. Paul, are you here? No, well maybe Paul will join us later. Thank you. I'd next like to go on to the minutes of our meeting on the 21st of July. Do we have any comments about those minutes, please?
If I can come in there, Chair.
Thank you.
Yes, on the middle of page 5, it says that I said about people being shamed or guilted into not coming. I was referring to people who were both being shamed into coming and shamed into not coming. If that could be made a bit more clear. I feel it counterproductive either way to be shaming and guilting people.
Okay.
Thank you.
I'm sure Andy will note that. Thank you. Have we got John May on this meeting yet, please?
Chair, I don't believe he was intending on joining. I think he was otherwise engaged. I think he'll carry on as we are.
Okay, thank you. Well, in that case, I'd like to give John's apologies because I know that he is travelling back to Scilly today. But he did want to raise one item on the minutes where he was asking about a safe house, and he thinks the minutes should record the fact that I said as chair that I would follow that up. So if that could be changed in the minutes, please, Andy. And I know that Paul Masters is going to speak about that during his update. So if you could just change it in the minutes to say that I was to take that matter forward.
Indeed. As long as everyone is happy with that.
So is everybody happy with the changes from Harry and myself, please?
Yes.
Okay. Could I have a proposer that those minutes are adopted?
Happy to propose that, Chairman.
Thank you.
Happy to second.
Thank you. Anybody against those minutes being adopted? No, then they're carried. Thank you very much indeed. So we move on next to the outbreak and evacuation plan update. I would ask Paul to give us that update. Thank you, Paul.
Thank you, Chairman. Morning, colleagues. Just to deal with the point that was raised by yourself just now, Chairman, about the safe house. And I know we did discuss it last time, and Rachel might want to add comment later as well. But if you remember at the time, this all came around when we were trying to consider what to do when the 4th of July was being talked about as a possible opening up date for tourism. We were in communication at that time, particularly with the Island Partnership, about safe houses, etc. We haven't got anything available that would work as a council, and I know there was some self-help that was being done, particularly with the Island Partnership at the time, but I understand bookings have got even more complicated since that time, which is why we moved to the evacuation plan. And also, and Rachel will put me right if I'm wrong, the idea of moving people into a safe house was not deemed to be appropriate either from a public health point of view. So we did look into it at the time, Chairman, and we didn't consider it was a workable solution. and that's why we went for the evacuation plan, other than the stay where you are if you are symptomatic, and all the extra work we've done on testing, etc. So that was the first thing, and Rachel follows me with her update, and she might want to add to that. In terms of the evacuation plan, as you know, that has been subject to very, very thorough scrutiny, questioning from all parties, which was very successfully done at scrutiny, also signed off by Public Health England. As of yet, we haven't had to, luckily, call on that facility whatsoever, so that's excellent. The other action from me, Chairman, from the last meeting was to consider inviting Health Watch, and as you said, I've talked to Paul, and Paul has agreed to join this board representing Health Watch, although I'm not sure, Andy, whether he was able to make this particular one. To give the board some confidence, whilst we've got the outbreak plan in place now, we have been doing almost weekly, and Tanya's on the call who might want to add, tabletop exercises to test various scenarios, be it campsites or hotels, or getting people back to Exeter Airport. All of those exercises we learn from each time and improve our plans as we go along, which is absolutely what we should be doing. And recently we also invited our regional colleagues to observe one of our tabletop exercises. Jill Stewart, who's one of the national coordinators for outbreak plans, I'm also in communication with, so we're seeking to get further assurance from our regional colleagues, and I understand that led to some positive comments. There's also been a delegation down in the southwest from the Cabinet Office and Number 10 looking at outbreak plans across the southwest and how we are all preparing. And I understand the feedback to Number 10 was that the southwest was well prepared and was doing an excellent job, and particularly the regional directors of public health and the group that Rachel is on. All those directors of public health are working together in a really cohesive manner to try, to build some capacity across the southwest. Lastly, two more things from me, Chairman. You might wish to mention yourself that you've personally written now to all residents on the islands, in paper form, bearing in mind there were still some concerns about whether everybody still could access electronic means. So you've done a letter which I think lands this week to all addresses on the Scillies to give people further assurance of what they can do and all the things that we're doing. And lastly, I understand that in terms of tourism specifically, that the Joint Biomedical Centre with Public Health England is doing some deep dive work into tourist areas to see what may or may not be scenarios that might emerge. I think everybody's worried about the number of people who've been seen on beaches, etc. So that will be an interesting piece of work from the Joint Biosecurity Centre, which I'm sure we'll see in due course. And lastly, just anecdotally from me, Chairman, I think I am seeing some commentary coming from the islands where people are still being very universally good at trying to stick to the rules of social distancing and hand washing. There are some breaches of that, of course, and we continue to try and bring those basic public health messages to the visitors. But also increasingly, I think residents must also recognise that when their family members come to stay with them, we're seeing quite large congregations of family members, etc., that perhaps aren't following as many rules as we are with visitors. So I think we should all remember that we've all got a part to play together in this, in terms of trying to remain vigilant to the public health messages. That's all from me, Chairman.
Thank you very much for that, Paul. Tanya, did you want to mention anything further to do with your preparations and tabletop exercises?
Thank you, Robert, and thanks, Paul. Yes, Paul just did mention briefly about the exercising, the tabletop virtual exercising that we've been doing in the local incident response team. So we've been doing these exercises on a weekly basis with all the partners of the local incident response team, including the transport providers. And actually they've been going really well. So Paul just mentioned, we've looked at evacuation at Exeter. We did a really good exercise last week with campsite owners and operators, talking through what would happen if we had an outbreak on a campsite, how we'd manage it, how we would support the campsite owners, the comms that would go around that process. We've also looked at an outbreak in a local pub and how we'd respond to that, how we'd work with our colleagues in environmental health. So it has been a really useful process, and we'll continue to do these on a weekly basis. We have another one this afternoon, and I believe our colleagues from Public Health England will be overseeing that exercise as well, which is positive, and we'll, I'm sure, receive some feedback from that in terms of how we can improve and make our processes more robust. And that's what we're doing on a weekly basis to ensure that the plans that we've put in place are robust and will work should we need them. I should just say that the testing is still going well. I'm sure Rachel will touch on it as well, but it's still going well, and we're continuing to undertake testing as required, both symptomatic and routine. And the logistical challenges of living on a rock in the middle of the Atlantic obviously are still there, but we're really pleased with the process of testing. We're thrilled with how it's going. It's running really smoothly at the moment, and even in days where we have fog, getting the tests off the island and working with those transport providers, particularly Steamship Company and the Royal Cornwall Blood Bikes, the volunteers who are doing an amazing job in meeting those samples and getting them to the lab. And obviously the pathology lab turning those results around for us and reporting back to us as swiftly as they can. That's probably it from me.
Okay, thank you, Tanya. Does anyone have any questions, please, for Paul or Tanya on that? Thank you, Joel.
Yeah, it was a question for Tanya, really. It's what is the average time now for a turnaround of a test? I know we were aspiring for 24, 48 hours. Now, at times it was slipping a bit beyond that, and obviously fog will not help that cause. So I was just wondering what the average time is now for getting a result back to us.
I don't have the average time straight in front of me, I'm sorry, Joel, but I can get that for you. We have seen a quicker turnaround in tests over last week, which has been really good, and I'm aware of a test that we did last week that came back within less than 24 hours, so that's really good. We aim to have tests within 48 hours, and on the whole, we are doing that, obviously fog permitting.
Thank you very much. Any other questions, please, for Paul or for Tanya? No? Okay. Well, thank you very much, Paul, for your report, and Tanya for your further update. So we move on now to the public health update, and I'm very pleased to welcome Rachel Wigglesworth, our Director of Public Health. And perhaps, Rachel, during your update, you could just mention, I think Whitney mentioned at our last meeting that there might be a paper leaflet coming out from Public Health to go to those people who were not connected to the internet and so on, of which we have a number of residents on Scilly, both on St Mary's and on the off islands, and hence my letter to those various residents, and just wondered whether or not that wasn't, my interpretation is right, that there was going to be a little paper leaflet as well from you. But could I welcome you and ask you to give your update, please? Thank you.
Thank you, Chair. And so thank you for, this is the first local Outbreak Engagement Board for the Isles of Scilly that I've attended, but I am also a member of the local Outbreak Engagement Board in Cornwall as well, and also the chair of the Health Protection Board, which covers both Cornwall and the Isles of Scilly, just to remind people of the different structures that are in place, how I sit across those. So I think there's been some helpful updates already on the situation from both Paul and Tanya around the Isles of Scilly, so can confirm no positive cases, although clearly the exercising of the plans and the use of the testing, the enhanced testing on the Isles of Scilly, is giving us assurance that there's plans in place, that they're being exercised, and that we, at the moment, the team are doing a super job in assuring people that we have plans in place and reassuring local people that they can have access to testing where necessary. So very pleased that that's currently the situation. Across in Cornwall and mainland, obviously there's a few numbers of cases each week. We've had, over the last 7 days, 11 new cases. dispersed across Cornwall in small numbers, mainly related to people who are working in care homes and are being routinely tested for COVID every 7 days. And it is picking up that these small numbers of cases that aren't related to clusters, but occasionally are a small number in a care home setting, and then some small sporadic cases within the community. So that's the sort of picture across the across the Cornwall mainland, that there is obviously virus circulating at a very low level. We are working in public health to follow up and work with the test and trace scheme in terms of actually contacting cases and ensuring that work is done, so that we're really trying to suppress the virus in the Cornwall mainland. Clearly there's a different picture in other parts of the country. Just in Swindon is the area of concern within the southwest peninsula. So lots of work being done around managing an outbreak which is related to a particular industrial unit and workplace setting, with many people travelling in and out and sharing cars within that setting. So we're learning from different scenarios that are going across the country. Clearly there's areas which have higher rates, including the Blackburn and Darwen, Leicester, Luton areas, which are of particular concern. So they remain the highest sort of areas nationally. But clearly there's a different picture, as I say. So reassuring that in Cornwall and the Isles of Scilly, we are in a good position currently. So you've already mentioned exercising. I think Tanya and Paul have both given good accounts of what's going on, and I understand there's a Tresco-based exercise this afternoon, so really good that we've had that, and the involvement of Department of Health and Social Care in terms of that oversight and scrutiny of how that is working, and we're sharing that practice, as Paul said, across our networks to learn from that. I know there is a communication strategy that is planned, which I think you'll cover at the next item, so I won't go into detail on that, but I know that our public health team are very closely involved in that, and as you'll know, particularly Whitney Curry, who has been very active in supporting you. So unless there's any questions on that, I just thought I would just give you a few links into some of the subjects discussed in the Cornwall Local Outbreak Engagement Board. So I'll continue unless I see any hands up, or you stop me. So we, at the Health Protection Board, which covers both Cornwall and the Isles of Scilly, and Paul is a member of that board, we've looked at a testing strategy, which is going to come for full approval at the next meeting, but that will cover the future of testing and how that can be ensured that we have maximum uptake and ability to be able to flex that if we do have outbreaks, and move facilities and make sure they're in the right places. So that's going to be considered. We've been looking at the test and trace programme. As I said, we've put some extra resources locally into doing the test and trace, and we have a case management system that records all our information, and we're finding some interesting results from following up some of the cases and finding some extra information. So that's been helpful. We've also been reviewing events that are planned within the area to ensure that we have oversight of that. And there's been some new guidance that's been issued around shielding and how that could be used and introduced, or if necessary. But clearly that's a national decision, but locally we have the ability to be able to communicate with people who might be shielding and warn and inform if there is experience of an increase in COVID cases in any particular area. So that's obviously in our sort of communication strategy, how we use that. And then in terms of the Outbreak Engagement Board, Cornwall, we very much focused there on communication strategy. And at the last board on Thursday, we talked about the role of the board in a scenario. So it was just to develop clarity on if there were outbreaks in the scenarios that we were considered. How does the board see their role? When would they be informed about particular issues? And obviously for Cornwall that might be different to clearly the Isles of Scilly. But in terms of using the learning from a scenario and actually considering that leadership and communications role that the board plays, I think that was helpful for members to see how they would be included in that. So unless there's any questions, I did pick your comment, your question up about Whitney and the paper leaflet. I haven't got information on that now, but I'm hoping maybe in the communications section that they could have that to respond back to. But otherwise, I'll find that outside of the meeting. Thank you.
Thank you very much, Rachel. I think Stephen's got his hand up for a question. Thank you.
Yeah, thanks, Chairman. We've not spoken, Rachel. My name's Stephen Taylor. I'm the Deputy Monitoring Officer. I just wonder whether there's been any experience or any thought given as to issuing any directions under the number 3 regulations and what the criteria would be that you would consider necessary, and whether it would have to be an actual outbreak or whether the prospect of an outbreak, with there being a great deal of overcrowding in particular areas or whatever, would be enough to give a direction in relation to individual premises. I'm not particularly thinking of the co-op, but I have to say there was massive queues last night and this morning at the co-op, and people do seem to be respecting social distancing, so it's not a massive problem at the moment. But I just wonder whether any thought given as to what criteria would be if there were other premises or open spaces.
So I think you're referring to the coronavirus sort of regulation.
Yeah.
So there's been the Contain framework was published at the end of July, which gives some more clarity around the powers that local authorities have around intervening, and so referring to closure of premises, public open spaces such as beaches or events. So these are powers that clearly are available to use. I think our general position around that is to use a preventative approach and working with premises, people, communities, before you need to escalate to using those powers directly. Clearly there's some requirements about how those powers are used and reporting to ministers if you enact some of those powers. And I think generally we'd feel the best approach would be, like environmental health teams that work alongside communities to talk to premises and work through the issues, as opposed to try and sort of go in sort of hard on that. So the examples where they have been used, would be expected to be more related to outbreaks of cases related to that facility rather than a preventative approach. So that's my view.
You're good, thanks. Thanks for that. I was wondering whether there'd been any other which have been used in the rest of the southwest, any of those powers yet.
So as far as I know, so the Swindon issue would it depends again whether the premises was closed under a voluntary arrangement or whether the regulations would have to be enacted. And again, I think in many circumstances in the work around infectious diseases or outbreaks, that is a voluntary process. But clearly that is going to be used. But the more sort of the files that are more escalated in the other areas that have more serious outbreaks, then of course they're being used in more commonly there. But as far as I know, that's the situation at the moment in the southwest of Swindon.
Thank you.
Thank you. We have Joel Williams, your hand up. Joel, thank you.
Yeah, thank you very much. I think if I understood correctly, Rachel, you were saying that there's been some learning in Cornwall about how the engagement board would be mobilised if an outbreak occurred and all those sorts of things. It would certainly be useful from my point of view to have a sort of a summary of what you learned from that, the process, the flow chart, so we could be up to speed on that as well if possible.
Thank you. Yes, happy to share that as soon as it's available, Joel. Thank you.
Thank you very much. Do we have any other questions for Rachel Wigglesworth, please, from any members of the board? No. Well, Rachel, thank you very much indeed for attending today, and we much appreciate your report and all the work that you're doing. Thank you very much. We'll move on to the next agenda item, which is the communications update, and I'll hand over to Tom Walton. Thank you, Tom.
Thank you, Chairman. Just to say, on the previous issue, I'm not aware of a paper leaflet. I'll pick up with Whitney Curry next time we speak. So if there is one available, I can way. So we're continuing to put out the regular drip of warning and informing content. Much of this comes from government. Obviously, one of the issues we're having right now is we're looking at sort of 6 months of this type of messaging for the public. So there is a risk of habituation. At present, though, there's still a high volume of new messaging from central government, and we do have a duty to continue to promote all of those messages. So, for example, recently on the 8th of August, new guidance came into play with the types of face coverings that were acceptable and the ones that weren't. And that type of content is just, it's almost daily. So we do need to keep up with that. Outbreak comms is slightly different, and that will depend on what happens if there is a positive case on the islands. And as Rachel mentioned, there hasn't been one so far. How many people are affected, whether it's residents or visitors, etc., that will all affect how we respond. So we're currently working with Whitney Curry on pre-prepared messages for different scales of outbreak. The reality is, on Scilly, lots of outbreak scenarios are likely to affect a small number of people. So we have to balance the community with the individuals involved. It's not like in a city where you might get a whole segment of the city that's affected, or you might get a whole warehouse, that kind of thing. So we're trying to balance that and make sure our messaging is correct. Really, at the small scale, we're looking at comms that involves the interaction of individuals with the council and affected sites, but obviously wider infections will call for wider communications, and the privacy risk to individuals is less there. So we have a separate style of messaging for that. Again, that depends on the types of intervention that are required, whether there are interventions on, or at least advice on transport, etc. But those are the messages we're working on in the background. I'm just waiting, though, for Public Health are going to provide me with the escalation points. So there's various different escalation points depending on the scale of the outbreak, and they affect the messaging that we put out. So as soon as I have those, we'll be able to confirm the messages and share with the group. Following the last meeting, we're in contact with the adult social care team about the board's comments on the need for more paper to get to vulnerable groups. In the end, this comment was really overtaken by our decision with the chairman and chief exec that now is actually just a good time to write to all residents, regardless of what cohort they're in, about the council's response to the pandemic. This is obviously something we've considered over the course of the pandemic, but we judged that now there were enough plans and procedures in place that we could commit some concrete actions to paper that wouldn't date too quickly. The issue we had early in the pandemic was that anything we put on paper was just dating, within a couple of hours in some cases. The letter stresses the need for people to keep abreast of the latest guidance through the normal means and support those people who don't have access to the internet for whatever reason. But these letters, they're printed now and they should be posted today, so with residents by Wednesday or Thursday. Councillor Williams got in touch with us, and he made the suggestion that we put more content relating to the key safety messages and our reception points of buildings, even if they're not being actively used at present. And I think, that has been an effect of the pandemic, that because the building lies empty, there are fewer people using printers and, less likely to sort of dress the windows with the types of posters and messaging we would have previously. So we gave the town hall windows a good clean yesterday, put some posters up there, and we've also been in touch with Joe Evans to make sure the library and Conguab will have similar messaging up there. We've concentrated on the central government messaging to make sure they're exactly in line with the national approach, and we've also posted paper posters to everyone on the councils on the off islands, so they can take a call about whether they're sort of post offices or community centres too. So if anyone wants copies, we can certainly print them and get paper available if anyone wants. And that's the latest on comms since the last time we met. I think the big news is that letter will be going out to everyone now, and I think that probably addresses most of the sort of immediate concerns everyone had last time. Because there's no doubt there is a portion of the population who just do not have that access to the internet. So we just want to make sure that they have the right contacts available and phone contacts where necessary if they can't keep up.
Okay, Tom, thank you very much indeed for your report. Paul, I think you wanted to come in. Paul Masters.
Yeah, thank you, Chairman. Thank you, Tom. I just wanted colleagues to realise that that the EM team and Tanya on the call, etc., have been full out really doing all of the excellent work to get us ready and be in a good place should we have an outbreak on the islands. But I think we've come to the point now where the plans are still tested, of course, and we're still going to be doing the tabletops that Tanya talked about. But talking to Whitney last week, I think there is a period now that we're almost like needing to realise that this is the new normal for a while, and that we've done all the work to prepare, and perhaps we need to sort of not play it down a little bit, but give people the confidence that those plans are all in place, and we don't need to be overly pushing messages, because we need to sort of realise that this is a bit of a normal life situation that we wouldn't want to be in, but we're in it for the moment, and we're well prepared, and perhaps there's a moment for us to sort of calm down a little bit from all of the excellent work that we've done so far. So you might see us perhaps sort of beginning to slip a little bit back to normality of other things that are going on, such as the dreaded word Brexit and all those other things that we've almost put on the back burner. But we will be informing the engagement board of those moves, and that's why there's a bit of work going on behind the scenes now in terms of sort of saying, right, okay, we've done that emergency management stance, we've got all the preparations in place, and now, as Rachel was talking about, what's going to be our comms strategy going forward. So when we've given that some thought, Chairman, we'll bring that back to the board. But it's in effect a sort of, we're in a good place, don't be overly alarmed, and now the communications perhaps will be changing a little bit as well. So just a broad update on that.
Okay, thank you very much indeed, Paul. Are there any questions for Tom to do with communications, or indeed to Paul, please? Welcome, Paul. Welcome, Paul Charnock from Health Watch. You've got a question, Paul. Thank you.
Yes. First, my apologies. I had a battle with IT this morning, but eventually conquered it after about 20 minutes. So I was late coming to the meeting. What I can offer is that any information via leaflets, letters, if we have a copy or of such, we can use them to get to one or two people who aren't in the mainstream of IT, on you being able to use the websites, etc., through our volunteer visiting service, and we're working very closely with adult care as well. So we will offer whatever support we can in easing communications to the places that are sort of more difficult to get to sometimes. Might only be a few people, but it might be important for some. Okay.
Okay, thank you very much indeed for that offer, Paul. So we move on now to any other issues to be brought to the attention of the board. Would anybody like to bring any issues forward? Well, while you're thinking about that, I'd like to raise one issue. I don't really want us to deal with it fully today, because it's going to need some further work from officers, and indeed in consultation with Darren, our police sergeant, who's on the call. But I am getting increasingly concerned about the antisocial behaviour that we're having on the beaches around Scilly. I have a lot of complaints coming to me and to other councillors, and unfortunately it's getting somewhat of a problem. So we need to deal with that outside of this meeting. The reason I'm raising it now is because obviously there is a COVID-related concern here as well. It's not just antisocial behaviour. There's large gatherings. When I say large, there's gatherings of more than the legislated numbers of people that can get together on the beaches, and we obviously need to deal with this. So I just raised that, and we will deal with it outside of this meeting, but just so that all of you on this call and those listening to this call know that we are considering how this can be dealt with in a sensible manner. We're not wanting to overreact. We want people to enjoy Silly, but we don't want some in our community to spoil Silly for others, and we certainly don't want to be breaking any legislation around gatherings. So I will just put that forward. Are there any other issues from anybody, please? No, everything's very quiet. Well, thank you very much, all of you, for your update today. I would mention that the next meeting of this engagement board is on Tuesday, the 22nd of September at 09:30. I hope we don't have to meet formally prior to that date. And thank you very much, everyone, for your contributions. And with that, I'll close the meeting. Thank you.